Hey, gout. Most common form of inflammatory arthritis. So many, especially Muslims. Muslims are known to have pretty bad cases of gout. Because of the diet. Yep. All right. So there are two forms of gout. We have primary and secondary gout. So the primary form is that's how your body metabolizes it. Okay, so your body makes so much uric acid. No matter what diet you have, your body just makes a lot of uric acid. Okay, and then you suffer this painful condition. Others are, of course, caused by diet. Say red meat, organ meats. Makes sense, right? Because organ meats are red also. Okay, they're very red. And then you have seafood as well, or certain medications. We'll go to the list later. And what happens is when your uric acid levels increase, they tend to settle down the peripheral areas of the body, which happens to be the toes. Okay. Among your five toes, it will be the great toe that will bear the brunt of the pain because the crystals, the uric acid crystals, will form on the great toe. Okay, so they get stuck there, can't come back in the circulation, so they get trapped there in the distal areas. When capillaries get so small, the crystals get stuck there, and then they cause tophi. Okay, so tophi are now the um, which will cause enlargement of the great toe, causing extreme pain. They can also form in the kidneys, so you can also have uric acid stones in the kidneys, but most of the time it'll be in the great toe. Now you may say, oh, so what? Why are we talking about this? Well, this can be debilitating. The pain gets so severe that the patient can't go to work, can't go to school. They cannot walk. The pain is so severe that even if you put a very light um, blanket, a sheet over the toe, that's enough to cause pain. So therefore, if it's that painful, it's that tender, how can they wear shoes now? How can they walk on their feet? So they can't, right? So therefore, do we need to manage this? Yes, because can they work? Can they pay taxes? We want people to pay taxes. All right. So here again, primary, your body is making so much uric acid, and it can also be caused by severe dieting or this type of diet here. I mentioned heredity, meaning your body makes a lot of uric acid. And secondary hyperuricemia or secondary gout, this is usually very common in cancer treatment. So let's say you have cancer and now you're treated with chemotherapy and radiation, right? So when the cancer cells die, what do all dead cells produce? Uric acid. So therefore, it can cause secondary gout. Okay, but are we sad about that? Not necessarily, because that means is the treatment working? Yes, we're treating the cancer. However, we just have to deal with the hyperuricemia that results, which we can treat. Okay, so we will treat those. Obviously, we will treat them. So other causes are, say the patient is on thiazide diuretics or loop diuretics. They can cause gout as well. So does aspirin. Manifestations, as I said, pain in the joint, especially in the great toe. So you'll see these people calling in sick. Okay, so my mechanic has gout. Okay, so every time I go and the shop's closed, I know what happened. Okay, and then I also know, I'll ask, oh yeah, it is. We just concluded Ramadan, and there's always a party, right? So during the party, what do you guys eat? Yeah, yeah. How do you celebrate after the Ramadan?
Oh, me.
Yes, lots of it. Yeah. Okay. And there's some, it's a big celebration. Yeah. Okay. And then they pay for it. So my mechanic, he says, ah, what the hell? Okay. So you just, he just, splurges and then close the shop the next day. They can affect other areas of the body as well. But again, if something happens to your feet, can you walk? No more. Well, you can wheel yourself around, but I mean, can you work as a nurse on a wheelchair?
No.
No. Let's go straight to the management. So how do we help these patients? Medication and dieting. So let's go to the protocol. All right, so you come into the hospital, hey, you're complaining of pain. Doctor, my toes hurt. Okay, so they draw blood, look at your feet. Okay, so it's gout. All right, so what do? They will give you pain medication, which will be what the patient's asking. Okay, yes, thank you. So what pain medications are ordered? For acute gout, we give them colchicine. Colchicine will lower the uric acid crystals, but this drug is fast acting. However, you cannot take it for more than a few days. Because it's harmful to the kidneys. So the patient will be on this only for short term. Other pain medications used will be NSAIDs, especially indomethacin, or a steroid can be administered. We can use ibuprofen, but between ibuprofen and indomethacin, this one works better. And what do you want if you have gout? Do you want something that works right away or a couple days later? Okay, now I want it to work now. Now, after the inflammatory process has subsided, so like I said, this is given only during the acute painful episode. So you get a few days here, 3 days maybe, and then after that, the inflammation should already have subsided. Now we have to put you on xanthine oxidase inhibitor, which is allopurinol. Now, allopurinol is for maintenance only. Okay, so this is not used for acute gout. It will not work. So for acute attacks, what do we use? Colchicine will be used. And then after the 3-day treatment, what do we do now? We switch you to allopurinol. Then you'll be on allopurinol. Well, depends how long, what type of gout do you have? Do you have primary or secondary? If it's primary, then that'll be lifelong. Okay, you take it every day. If it's secondary, well, of course, it'll just be given during the duration of whenever you have the high uric acid condition. If the patient has unresponsive attack, okay, besides we already put you on colchicine, then they can try heavy duty and more expensive medications like interleukin-1 receptor agonist, that is anakinra. If you remember this was also seen given in rheumatoid arthritis. Yeah, so this was also an option in rheumatoid arthritis. And for non-pharmacologic management, it's the diet modification and of course avoiding which diuretics were mentioned earlier, thiazide and loop, right? So both thiazide and furosemide, and also what over-the-counter medication? Aspirin. Okay. So here are your. So what are purine-rich foods? So we said the red meats earlier, organ meats, seafood, especially shellfish. What else? Yeah, nuts are also high in uric acid. Alcohol, okay. Caffeine is not specifically mentioned here. For this drug, pegloticase, this is IV medication. This is only given in the hospital. Reason is this drug has a protein that is recognized as foreign, meaning no clinic will administer this. This can only be administered if the patient is inpatient. Okay, because in case they get a anaphylactic reaction from this drug, that at least we can treat it. We're in the hospital. Okay. So here's your drug chart. So we have colchicine, and here's your client teaching and your nursing responsibilities. Okay, on the third column, probenecid. Here's allopurinol. Okay, so under nursing management, you have your full list of medication, nutritional restrictions here. Organ meats, alcohol, lose weight. Oh, I thought there would be more. That's it. Any questions on gout?